Gentlemen, if your prostate surgery is booked and no one has really explained to you how to protect your bladder control or your erections, this video is for you. As a men's pelvic floor physiotherapist, the men I see who do the right pelvic floor training before surgery have less urine leakage, feel more confident, and get a head start on sexual recovery sooner. So buckle in, let's get you prepared correctly. So here's something important to note. If you have a prostatectomy date, chances are that your prostate has been enlarged and on the watch and wait list for years, often a decade or even longer. That slow stream, hesitancy, starting and stopping, double voiding, that's usually the enlarged prostate squeezing on the urethra. Remember, prostate cancer is a tumorous growth and it doesn't discriminate how it grows. Sometimes one prostate might just proliferate more in one urethra than the other. And so, to push urine past the more narrow urethra, many men subconsciously strain through their pelvic floor and their abdomen. This causes that bearing down strategy instead of that gentle lift upwards of the pelvic floor. Over years and years, that teaches the muscles around the urethra to bear down instead of pushing up. And so over time, those pelvic floor muscles get weaker and poorly coordinated even before the surgery happens. So, there are two main problems with post-prostatectomies. 1, urine leakage, and 2, erectile dysfunction. During surgery, the prostate, the internal sphincter at the bladder neck, and part of the smooth muscular tube around the urethra are removed. The urethra becomes shorter and is reattached to the remaining external sphincter, the rhabdosphincter, and the supporting muscles around the pelvic floor. That smaller ring of muscle now has to do much more work to keep you dry. Erections can be affected because the nerves that run alongside the prostate can be stretched, bruised, or partially damaged, even in those nerve-sparing procedures. So when it comes to preparing for a prostatectomy, I want you to think about it more along the lines of preparing for something like a knee surgery. You don't wait till after the operation to go ahead and strengthen the knee joint. And I'll tell you a secret. The people with the best outcomes post-prostatectomy are doing pelvic floor rehab prior to their surgery. This has been looked at in the research. One key study of about 100 men scheduled for radical prostatectomy compared a higher intensity pelvic floor recruitment program to a lower intensity program. These protocols were administered 5 weeks before the surgery. The lower intensity group did what many people were told. You know, the classic 3 sets, 10 repetitions, hold 10 seconds, do this once a day. This amounted to approximately 30 pelvic floor contractions a day. The higher intensity group, however, did a much more focused routine. 6 sets a day, with each including 10 fast 1-second squeezes and 10 slow 10-second squeezes, with equal rest, adding to approximately 120 contractions a day. Again, they followed this for about 5 weeks prior to surgery. And so, it might not be a complete surprise that the men who did the intensive program had significantly less urine leakage and a faster return to continence compared with the men who did a lighter routine. Their continence-related quality of life scores improved sooner, with meaningful benefits already showing at about 2 to 6 weeks after surgery. And this created a bit of a paradigm shift with how we look at post-prostatectomy training. Just like with any other muscle, we want to load it with moderate intensity. So now for the honest part. Almost every man post-prostatectomy begins to leak once the catheter is removed. That is completely normal, it's expected, and I don't want you to treat it as failure. Keep in mind that with the correct pelvic floor training, most men achieve full continence between that 3 to 6 month period. However, erectile function scores are slower, and medications like Viagra or Cialis in the first 6 months after surgery only work for a minority of men. Remember, nerve healing often takes months. So, pelvic floor training does not cure erectile dysfunction on its own. But studies show better erectile scores at 6 and 12 months when men commit to pelvic floor exercises and the appropriate penile rehab. And a crucial point of this is psychological. As continence improves and leakage becomes less embarrassing, men are more willing to resume sexual activity, which is itself part of rehabilitation. So, returning to erections is usually harder and slower than staying dry, but the more you do your pelvic floor training, the better your odds. If you have never been taught how to do a pelvic floor contraction, let's go over it together right now. Sit or lie comfortably, just like how I am in a chair, and grab your fingertips and place them directly on the perineum, which is that spot between the anus and the testicles. With that tactile feedback, I want you to visualize a few cues. use. 1. Shortening the penis into the body or gently drawing it inwards. 2. Stopping the flow of urine. Or 3. Lifting the testicles slightly up into the body. You should feel a very subtle increase in tone in the pelvic floor and a slight flicker at your fingertips. And please, for the love of God, no bad contractions. I don't want you bracing your core, squeezing your groin, or squeezing your glutes. Just a gentle, nice, easy contraction at your pelvic floor. If you want a more in-depth tutorial on this, I've made a previous video on pelvic floor contractions, what you should feel, and how you should do it. Find it in my channel. So, if you're watching this video, chances are you're willing to put in the work 5 to 6 weeks before your prostatectomy. So here's the specific framework that I want you to do today. 6 sets a day, and in each set, I want you to do 10 fast contractions where you squeeze and then fully relax as quick as you can. This may take a fraction of a second to contract and a fraction of a second to relax, and complete for up to 10 repetitions. Next, I want you to do 10 slow contractions. Gently lift and hold for up to 10 seconds and then fully relax for that 10 seconds. Remember, the rest phase should equal the amount of time you've spent in the working phase. That adds up to about 120 contractions a day, combining both speed and endurance. This was very similar to what was done in that high-intensity research protocol. And remember, the aim isn't pure strength, it's about control and precision. No bearing down, ensure you have full relaxation between reps, and you want clear on and off contractions. And once you get your surgery, you should expect to be using continence pads right after surgery. This is normal and not a sign that the pelvic floor training has failed. Having pads ready, knowing how to place them, and understanding that leakage should trend downwards over the weeks to months makes this phase less frightening and less embarrassing. So, if your surgery is coming up sometime this year, think of your pelvic floor as the most important rehab muscle. Of course, you can't control every detail that's going into the operation, but you can go in with a stronger, better coordinated sphincter system. If you found this helpful, go ahead and like and subscribe my content so you can see more prostatectomy videos in the future. And if you want tailored guidance, I recommend seeing a men's pelvic floor physiotherapist in your area so they can figure out a treatment plan that's suitable for you. Thanks for watching.